Between 2000 and 2009, families have seen their health insurance premiums double here in America. We must do something to help drive this cost down. Through the passing of a single-payer healthcare system, we will be able to lower the cost of healthcare here in America. And this will also help give people an equal opportunity to healthcare that they might not otherwise have to help treat different chronic diseases that they might have. The passing of a single-payer healthcare system will lower the cost of healthcare here in America by eliminating many of the unnecessary administrative costs we currently have. It is estimated that 31% of the cost of healthcare here in America is associated with administrative cost. This is due to the large number of private and government insurance agencies. This information is according to the Physicians for a National Healthcare System. The cost for providers would also be greatly reduced, instead of them having to do with the different hundreds and thousands of different private and government agencies out there. They only have to deal with one insurance agency. A single-payer system will also allow everyone to have access to healthcare. Around 45,000 people die each year because of the lack of healthcare insurance. The cost of healthcare premiums has also doubled here in America in the past 10 years, causing many families to have to go without healthcare because they simply cannot afford it. As you can see from the chart, the cost for families has skyrocketed, where the cost for families has risen, but not quite as much as it is for families. If this trend continues, in the next 10 years, will the cost for families double again? We simply cannot let this happen. When people are covered under a healthcare plan and have regular visits, they are able to prevent and treat different chronic diseases they might have or would have had. In conclusion, passing a single-payer healthcare system will help lower the cost of healthcare here in America and also provide insurance to those who otherwise could not afford it. A single-payer system will help lower this cost here in America and cover many of those people who otherwise would never be able to afford it. We have a chance to help reduce the burden of the healthcare cost here in America for everyone. And the single-payer system will help save lives for people who otherwise would not be able to afford healthcare coverage. We have time for anyone who wants to ask any questions.
Yes, I have a question. What is causing healthcare costs to increase so much?
That's a good question. Well, there are a number of things that are causing healthcare to increase. The largest factor is the cost in treating people with chronic diseases. There is a cost of treating chronic diseases as estimated according to the CDC from 2011 that around 75% of the total national healthcare expenditure is going towards treating people with these different chronic diseases. There's been a tremendous rise in treating these diseases from people caused by obesity, diabetes, heart disease, and different things like this. Some of these things are preventable if people simply had access to healthcare plans to help them deal with these issues at a younger age. If we brought down these costs, our insurance also would decrease in cost. Also, like I said earlier, 31% of the administrative cost of the total healthcare expenditure is having to do with administrative cost, according to the Physicians for a National Healthcare Program. By eliminating some of these chronic diseases and these administrative costs, we should be able to reduce the entire healthcare cost by a great deal. I have time to answer any other questions?
Yes, I have a question. What is the difference between single-payer healthcare and a more free market style?
That is also a very good question. A single-payer system is a system that is ran through the government, whereas a free market style is ran through different insurance companies, where the people have more control over what coverage they want or they need. And the more coverage they're willing to pay for, the more coverage they'll receive. Whereas a single-payer system, everyone has the same healthcare plan. It is one plan that the government offers. They will provide you with the doctors that you need. They will provide you with the specialists that you need. You usually don't have too much of a choice with seeing different doctors of your choice or the different specialists. Whereas a free market style, you can choose your doctor and you can choose your specialist. There's also, with a single-payer system, some people complain that you have to wait longer to see different specialists. Also, you have to see the specialist that the government recommends. And also, some procedures are not covered, just depending on what the government decides. Also, with a free market system, you can pay whatever procedure you'd like to have. You can usually get as long as you're willing to pay for it. And you usually can get it a little bit quicker than on a single-payer system because of different wait times. a free market system, people are in charge of their own healthcare. There is no mandatory healthcare program that they have to attend. Whereas with a single system, the government will usually want you to see a doctor within a certain amount of time to make sure that you're in good health. The information from the graph I got from USA Today in 2009. Thank you.